Hey, Dave O'Sullivan here, and just in this video today, I want to talk about something that I chatted to a therapist on a coaching call yesterday, and that was all about how they felt that in the objective assessment, the process as they went through it, that there was so much noise in their mind that it felt like that they just couldn't slow down their mind and actually process all the information in front of them. And that's very, very common thing. And it certainly was something that I experienced when I first started out. And you find yourself, as you go through the objective assessment, you go through the motions, and then you're left after the objective assessment kind of staring blank at the patient, and then you usually tend to just make up something that's pretty unconvincing in all honesty. Okay, that was certainly my experience with the first few years, especially in private practice. So how we're going to solve that is we're going to need to do three things. Okay, the first thing is you're going to need a structured approach to your assessment. Okay, so again, the structure is going to allow you some familiarity, okay, which is going to calm you down a little bit. Okay, so as you go through the objective assessment, you need to do that in a very step-by-step structured way. Okay, so your objective assessment should build on top of your subjective assessment. Okay, so everything that you've done in your subjective assessment up to now, it should actually complement your objective assessment. So that's the first thing. So if you find that you're flying through the subjective assessment and you haven't actually got useful information, then that could be the place to start for you. Okay, now if you've done a solid subjective assessment and you're pretty clear on what's going on, and you've built up a working hypothesis, then the next thing, tip number 2, will help you. Okay, and that is that you need to ask yourself questions during the objective assessment. Okay, so again, some of the questions I ask myself is, as the person is doing the movement, I ask myself what isn't happening, that if it was happening, it would take care of the symptoms once and for all. Okay, so what isn't happening, that if it was happening, it would eliminate the symptoms. Okay, so again, someone with a toe touch and they're not mobilizing well through the rib cage, they're maybe putting some more load on the low back. So in that scenario, if the rib cage had more mobility, then that would take load off the low back, and maybe the pain experience would decrease. Okay, or it could be something with the hamstrings or something else. Okay, and again, the answer to that usually is in the subjective assessment, which is why that builds into that. Okay, so that's the second thing, is ask yourself questions. Questions are really powerful because they help you focus. Okay, so they focus your mind. So all that noise is essentially just a lack of focus. Okay, a lack of clarity. Okay, so that's the second thing. Number 1, get really clear in the subjective assessment from a step-by-step structured system. Number 2, ask yourself questions as you go through the objective assessment. Okay, and then number 3, that you really want to implement straight away also, is you want to start designing the treatment plan before you go into the objective assessment. Okay, so again, what a lot of people do is they go into the subjective, they fly through that, they go into the objective, they fly through that, and then they kind of make some explanation to the patient. They do a bit of hands-on, they do a bit of rehab, and there's actually never actually a treatment plan designed. Okay, now if you actually if you design your treatment plan at the start, guess what that's going to do then? That's going to allow you to focus also with your objective assessment on a much deeper level. Okay, so then as you go into the objective assessment, you're super focused, okay, on the movements that the patient wants to be able to do and needs to be able to do. Okay, and then that's going to really build on top of the first 2 points. So you're going to have had a really good subjective assessment. You're going to have a working hypothesis. Then you're going to ask yourself what isn't happening during these key movements for the patient that they want and need to be able to do. Okay, and then you're going to start to really get your answers, really useful, powerful information out of the objective assessment. Then that's going to allow you then to explain the problem, the solution, and the plan to the patient. That's going to be really meaningful to them. It's going to be high value to them. And then on the back of that, then you're going to be able to prioritize quickly where you need to start due to the answer to question number 2. Okay, so if that makes sense, just pop makes sense in the comments. If you want me to go over anything like that, just pop a question below in the comments. More than happy to answer them. Okay, so the next time you feel rushed in your objective assessment, you feel like you're not getting the relevant information from the patient, especially if it's a complex patient, then go back through and it'll probably be one of those, if not 3 of those points there. Okay, so that's it for today. Let me know